As promised, we want to keep you updated on what's coming up and going down at the federal level. So we're back to give you a small but potent bite. He's Nate and I'm Andrew. This is another policy bite from our corner.
The big update is that the Senate passed a budget reconciliation bill and the House passed the Senate version as well, which means they'll work together to figure out what potential Medicaid cuts could look like. While the Senate version doesn't specify the same level of cuts as the House version, many in both chambers are saying they're committed to significant cuts.
We're also hearing that the focus right now is on Medicaid expansion, including cuts to the matching percentage and work requirements. As a reminder, any reduction in the federal matching percentage means Utah's expansion program is repealed the following July, unless the legislature makes changes. While we don't think they can hit the 880 billion in cuts with just expansion alone, and some are hearing the number could be closer to 500 billion, we're skeptical that expansion is all they'll come after. As always, Nate will stay hopeful, though.
The other thing we're hearing is that they have learned from the efforts to cut Medicaid from 8 years ago. The exact proposal language might not be publicly available until just before the vote, making it harder for us and others to let folks what it could mean. We will do our best to let you know as soon as possible, but our last Medicaid policy bite goes through all the potential cuts and what they could mean for Utah.
We also want to note, with all the attention on expansion and work requirements, that those cuts would have on a huge impact on those with mental illness and substance use disorder. Given all the funding the state and private partners have poured into these services, as well as those attempting to address homelessness, we would hate to see all that get rolled back over cuts at the federal level.
So lastly, we just want to remind folks to reach out to the delegation about these potential cuts. And if you have connections to those working on homelessness or the mental health and substance use systems, we would encourage you to reach out to them and have them contact the delegation as well. As always, you can see any updates on what we're following on our social media, all those links on our website, disabilitylawcenter.org. And please let us know if there are other things you want us to cover in a future bite. And thanks for watching.